Hello, everyone. Thank you all for tuning in to the Mayor's Pre-Summit Conversational Series. I'm Catherine LIMPEROPOULOS, Chief and Director of the Developing Brain Institute at Children's National. On September 15th and 16th, Mayor Bowser will host the 4th National Maternal and Infant Health Summit, and we're excited to highlight the importance of providing interventions that are lowering anxiety, stress, and depression, which helps to improve the overall well-being of pregnant women and their babies. For more information about the summit and how to register, please visit dcmaternalhealth.com. The Developing Brain Institute, located right here in DC, leads the world in the application of sophisticated brain imaging tools that really allows us to help pregnant women and their babies lead better and healthier lives. We have grown significantly over the last 10 years, starting with just a handful of people to over 50. We know that roughly 1 in 4 pregnant women may experience stress, anxiety, and depression during pregnancy. So if you're pregnant and feeling a little overwhelmed, you're definitely not alone. But up to 3 in 4 pregnant women experiencing maternal psychological distress are never identified, and so they're never treated. That's when Project Rescue comes in. We're offering tools to help women manage their stress at a time when they need it the most. COVID-19 has put the entire world in collective anxiety. Schools have shut down, people have lost their jobs, thousands have gotten sick, and unfortunately, so many have died. We know that pregnancy in and of itself can be a stressful time, but we know very well that pregnancy during COVID has added multiple layers of stress and anxiety and has increased depression during these times. We redoubled our outreach to ensure that we are reaching Black and Brown moms. We know that these particular communities have been especially hit hard by COVID-19. You know who I am. I'd like to now introduce you to the stellar team we have amassed that's going to join us today. We have ALISHA Bradshaw and GIGI Bond, 2 moms that gave birth during the COVID-19 pandemic. And we'll also hear from 2 of our staff that have been very actively involved in our Project Rescue, Catherine Lopez and KRISTINA ESPINOSA. We'll first hear from Catherine Lopez.
Hello, my name is Catherine Lopez, and I'm the Clinical Research Program Lead here in the Developing Brain Institute at Children's National Hospital. Our team worked to create Project Rescue at the start of the COVID-19 pandemic with the aim of really trying to understand how are women feeling being pregnant during a pandemic. No one ever thought we would live through a pandemic. No one ever thought they would be pregnant during a pandemic. So we really wanted to provide tools, free tools that our participants could use to hopefully help reduce some of this really new levels of stress, new levels of worry that were presenting themselves. Our study did include women who were testing positive for COVID-19, which was an added layer of distress, as we know now. Our team ultimately understood that the potential impact of COVID on a fetus, or even the long-term potential impacts on a baby, were really unknown. So that is something that drove this study and the aims of this study, sort of figuring out what will this look like down the line. To provide tools to help our participants hopefully reduce some of these levels of worry, anxiety, stress, our team created evidence-based mindfulness meditation and a yoga intervention. This was an intervention that was easily accessible from a phone, from a computer. It was free, and it could be used at any time. This intervention would also help us to inform any potential positive outcomes, really any changes that we might see from the use of it, whether it be reduction in stress, reduction in anxiety, or any other changes that we were making note of with the tools that we were using to measure these outcomes. Recruitment was really key for this study. As we know, at the beginning of the pandemic, and even still, in-person interactions were very limited and still are very limited. Our team had to think quickly on our feet to figure out how are we going to reach these communities. We really had to use different forms of social media on Facebook, Instagram, LinkedIn, word of mouth. Not only were we working with our partners in the community, different hospitals, different federally qualified health centers, we really tried to expand our reach by creating videos, flyers in both English and in Spanish. As we know, language can often be a barrier, in clinical care, but also in research recruitment. So we wanted to be accessible, and we wanted our research to be accessible. We wanted it to be equitable. We wanted everyone to have access to this opportunity to be presented with this and say, do I want to do this? Is this something that I want to do or not? So our team really worked to, as I mentioned, create resources that were both in English and in Spanish. Thankfully, also, our team, including myself, is native. Some of us are native Spanish speakers, which helps to quickly build rapport and see a person where they are, speak to them in their language and say, I hear you, I see you, how can I help you? So we really expanded the reach of our recruitment. We wanted to make sure that we included populations that were the hardest hit, as we know, as Dr. LIMPEROPOULOS mentioned, the Black and Brown population, mostly affected due to social factors, housing issues, work issues. So our team also had in place transportation, compensation, childcare oftentimes for some of these visits that were happening in person. Now I will pass it to my colleague, KRISTINA ESPINOSA, to talk a little bit more about what we know about perinatal mental health.
Hi, everyone. My name is Dr. KRISTINA ESPINOSA, and I'm a licensed psychologist at the Developing Brain Institute at Children's National Hospital. And so my role in the team is to better understand the factors that are affecting maternal well-being during pregnancy and in the postpartum period as well. And I'm also interested in understanding factors that may affect child neurodevelopment. And so, as we know, pregnancy is a tremendous change in a woman's life, and a lot of emotions and thoughts can come with it. And so we can have that excitement and that joy about the moment, about the future, but then we can also experience stress, anxiety, depression, that are also very common. And so all these emotions, what some of us say positive and not so positive, they're all very common during the perinatal period and the postpartum period. We also know that feelings of depression and anxiety that impact daily functioning certainly need our attention and our support. And there's many reasons for this, right? So we have our body, our mind, and our environment. And so our body, there's a lot of hormonal changes going through pregnancy and even after pregnancy. We have our mind, thoughts about, am I prepared for this? If you're a new mother or you're on your next child, still you're having thoughts of self-efficacy and do I have the support needed to push forward? And not only that, if there's past history of depression, anxiety that are re-emerging during pregnancy, that also shows as a risk factor. In our environment, right? So our body, our mind, our environment, and our environment is what's going on that could potentially be a risk factor. COVID-19 is a huge one, but what about access to healthcare, access to housing, access to support, so our family, our friends, and also trusted healthcare providers. So if there's anything to take home from this is that you are not alone. Mothers are not alone in this. We are experiencing a lot of unknowns, and that is what our mothers have really told us. There's a lot of unknowns during pregnancy, pre-pandemic, and they've just only been amplified now during pandemic. So we're here to help as a team. And now I'll turn to our two moms to give us their experiences on pregnancy during COVID-19, but also about their experience with Project Rescue. And so we'll turn to ALISHA and GIGI. And GIGI, if you can lead.
Hi, everyone. My name is GIGI. I am a mother of three, a perinatal health worker, lactation specialist, and just a general maternal health advocate. I'm happy to talk with you guys today. I recently gave birth about 11 months ago to a baby girl. And in this pandemic, it's a very new experience, even though I'm a mom of three now. The added stress levels from the pandemic, from the unknown has just been an ongoing theme, and it's been a very difficult familiar, if I will say. One thing that I've experienced daily is just not knowing how to be the normal mom that I'm used to be. So, I navigate normally, you wake up, you go, you do your motherly duties, but then you have this ongoing theme or narrative of what's going on outside my motherhood, role in my motherhood world. And there's a lot of unknown. So there is COVID, there is just the unknown of people being upset, being unsure, and all that impacts me daily. Like, it keeps me on edge, it keeps me frustrated. I have to constantly worry about every day. You already have the natural stresses of just being a human being and experiencing life. But now you have the motherhood, and now you have the pandemic, and what's to come, and what things look like going forward, which we all just are unsure of. So one thing that is really important for me is learning how to cope with those things. And one thing that I did recently, which was very liberating for me, was just went and had time to myself and enjoyed a swim. I did a walking meditation to the pool. When I was there, I really enjoyed it. I swam for about an hour, and I just remember, getting into the water, and, when you're in there, you're feeling so great, so free. And I just remember slowly just, letting my body submerge in the water and getting to a point where I'm floating, and my ears are underwater, and I'm slowing down, and I'm slowing my breathing, and I can hear nothing but just my breath, and just hearing my breath, and coming back to myself, and remembering, like, I have purpose, and I'm here, and this is what I'm doing to honor myself. I'm slowing down, and this is just a great experience for me.
Thank you, Gigi. My name is ALISHA Bradshaw. I am a physician associate at a local DMV outpatient center. And I had the honor of not having only one child during a pandemic, but having two. I had my daughter during the Zika virus. And that was, my first. It's like, oh my goodness, feeling a little anxious. Was supposed to go on my honeymoon. That got shut down because of the Zika virus, or not shut down, but I should say had to be postponed. But this current situation that we're living in with COVID was totally different from the Zika virus, because as you know, in the Zika virus, life continued. We just had to be cautious. We had to be careful. But with this COVID virus that feel like it just came out of nowhere, just took us by storm. And being present, or I should say being pregnant during that time period, it was just like really a lot of anxiety. You listen to the news, you hear the news, you hear all of the bad stuff that went along with COVID. And working in the medical field as a medical professional, I had to take added precautions. And I am truly, truly grateful for Project Rescue during that time period. And it was really interesting because I did not join Project Rescue until 6 weeks before I was due to deliver. But it was the blessing of it all, of being part of a project where it taught me how to be mindful. It taught me how to use tools to help me to breathe, not concentrate, to not focus on the pandemic, the negative, and just help me deal with it, deal with my anxieties, deal with my concerns, and how to center myself. Studies show that children can also perceive in the womb what we are experiencing externally. So there are so many unknowns that we were experiencing, and you couldn't just turn off the TV. At least I couldn't, because in the medical field, we had to stay up on what was going on. So it was really no turning off. So I am really, truly grateful for Project Rescue, teaching me how to meditate, how to deal with my anxieties, how to center myself, how to give me the tools necessary in order to deal with life. So I just want to share my experience and just want to say how grateful I am now that my child is a year old and I'm on the other side of the pandemic. I am just grateful for the opportunity to have participated.
Thank you everyone for your insightful comments. We are so thrilled that ALISHA, GIGI, and all of our volunteers participated in our Project Rescue. And we're especially grateful that they were willing to be part of this important study in the midst of the COVID-19 pandemic. We made these interventions available online, as Catherine said, so that we can make it really easy for women to access them from the convenience of their own home. ALISHA talked about some of the benefits of mindfulness and centering herself. And Gigi talked about some of the ups and downs and how by taking some time to float in the pool and just hearing her breath helped to center her. We've heard such uplifting stories. We would also like to share some good news. Catherine is going to share some exciting preliminary data from our Project Rescue.
Absolutely. So we didn't know what we would find. We didn't know what would happen when we started to implement these interventions. But so far, our preliminary findings have shown not only in the quantitative data, so the data, the numbers, but also in some of the feedback that we're getting from our patients, is that we've really seen a significant reduction in stress and anxiety among the women that are using these interventions. Again, the mindfulness meditation and the yoga intervention. On the other side, another positive outcome that we've seen so far is we've seen resilience has increased. So resilience, it's very important for women to cope, to be able to know I can do this. I have, whether it's myself or through my support system. So that was another positive change on sort of the other side. You have the anxiety and stress reducing and resilience increasing. So this is what we wanted to see. Again, we didn't know what we would see, but we were very pleased and we're excited to continue to see what will happen as we move forward. We also received some patient feedback. So along the way, we've been collecting sort of these numbers, but we also want to hear from the women that are using these interventions. What do you actually think about this? Is this feasible? Do you like it? What don't you like? But some of the feedback that I want to share with everyone today are feedback from 3 different participants. The first one shared with us, I feel more energized than I did this morning. Sort of back to what Gigi was saying, how she felt energized after her swim. Another participant said it was good. It was really good. With all that's going on in the world, it was good to just sit still and to breathe. And finally, our third participant stated, before starting, I was really anxious. And now I feel really calm and at peace. I can't tell you the last time I sat down for 10 minutes and just breathe. So that piece, along with the data that we're seeing, is really promising. It's very exciting, and we're really looking forward to continuing the use of these interventions for the women that continue to sign up for Project Rescue. So KRISTINA, I will hand it over to you so you can speak directly with ALISHA and Gigi about their own experiences as well.
Thank you, Catherine. And like what Catherine kind of mentioned, these techniques and these tools of mindfulness and meditation have shown in the greater literature that they are effective. And so it's so wonderful to hear that we're incorporating the yoga piece as well as mindfulness and meditation piece to reduce distress and increase resiliency. But when we hear that, we think, well, resiliency looks and feels different to each mother. And I'm wondering, as we're talking about that, what did it look like for you, ALISHA and Gigi?
And it's this ongoing thing. So I don't know when it's going to end. I don't know what it's going to look like a month from now. I'm about to birth a baby. Everything I'm doing is affecting my baby. It's my body, but there's a little baby in here and I have to find the best way to work through it. And for the most part, it was just not easy to ignore what was going on outside. So I know a lot of times just remembering to stay present within myself, that really helped me to kind of manage and cope a little bit. I also did some yoga and some meditation here and there. But when you're in the thick of it, sometimes you're not able to do those things. You're not just at home sitting around. You're at home and you're being a mother. You're doing other things. And for me, like, I do a lot of things for other people. So it's just hard to just stop and do what you need to do for yourself. But again, one thing that sticks out to me, or is a thing that I kind of pull from, is just remembering to be present and going back to remembering that little baby is in my body and I need to do what I have to do for me to make sure that my baby is going to be okay and my baby is thriving while she's growing and things like that. So that's kind of one way that I was able to cope and push through the pandemic. So Alicia, what were some ways for you to kind of stay present in the moment during this time?
Thank you, Gigi. For me, I feel like it was a little bit different in that I had to still go to work. Like I said, because I'm a medical professional, I had to see patients. And that was stressful in itself because, you know, people say, I'm here for one thing, but when you get into the room, it seems like everything that they told the medical assistant is totally different from what they tell me. And so there was that anxiety, there was that fear of, could this person possibly have the coronavirus? And, you know, that was very real for me. It was a very stressful time during that time period, but I am grateful because in those moments, I was able to step away and just take some breaths, remember what I am, what I've been called to do, but at the same time, recognizing that I am human, that I have concerns, I have angst, I have fears, and being able to be transparent with myself and having my village who I can call and say, hey, listen, I am not having a good day right now. I need you all just to either listen, to pray, whatever that case may have been. But I know through Project Rescue, that was one of the things that they've really kind of honed in on is understanding that self-care is the best care. And so during those time periods when I was feeling angst, being able to remember to breathe, being able to take even 5 or 10 minutes just to meditate, to center and focus myself, that helped me tremendously. I cannot explain that to you. And sometimes I feel like I don't know how to put it into words, but it's just when you feel like you're bearing the weight of the world on your shoulders, being able to have a tool such as just being able to breathe, just to close your eyes and kind of center yourself and go someplace else was truly, truly an eye-opening, but also a spiritual journey to where I was able to just kind of woosah for a moment and not stress myself out.
Gigi and Alicia, thank you for everything you shared with us. Thank you for giving us hope. And thank you for giving us a roadmap. As Alicia said, sometimes it feels like the weight of the world is on your shoulders. And it's okay to turn to someone who can help take some of that weight off. And as Alicia said, self-care is the best care. And it's okay. And in fact, it's important to take time for yourself, especially during times like these. I'd like to turn one last time to Alicia and Gigi to share closing remarks, and then followed by Catherine and KRISTINA. What advice would you give to pregnant women or new moms during the pandemic?
In the end, things always work out. You know, they may not work the way you want them or the way you expect them to work, but just know that, you know, you'll make a way, things will be okay, and you'll persevere. I myself went through a lot during my pregnancy. Things were going great as planned outside of the pandemic, of course, but I had issues with plumbing with my landlord, and I ended up, you know, experiencing homelessness 2 weeks before I delivered my daughter, and that was just very new for me. It was, I don't even have words for that experience, but sometimes we get support from friends and family. Sometimes you may not have that, and you only have yourself. And during that time for me, it was just me. I did have people reach out to me, but where I was staying, there were no visitors because of COVID. It's really important to be present and just remember it's you at the end of the day. No one else is with you. So you have to find ways to cope and use tools that are here, use resources, and be your own resource if you can, and encourage yourself to just make it through the day. Just find small things and find joy in them. So something as little as eating your favorite snack or hugging your child or just remembering a happy time in your life. Those little things can be very pleasant and can kind of help you overcome, even if, if you're in a funk for the day. So I just encourage you to stay encouraged and persevere, and just know that things will work out no matter what's going on outside. You still have you have your purpose internally and outside. So Alicia, what would you encourage moms during this time right now that we're still in a pandemic, we're still here, they're still unknown? What are some of the tools you would give for them?
You know, Gigi, you said something that was so profound, and I don't even know if you recognize that you said it. I remember when it came time for my birthing experience and going into the hospital, I had heard so many different things of, you can't do this, you can't do that. And so what I had planned as my birthing experience was something totally different. And what I heard you say, Gigi, was be flexible. During my birthing experience, my mom could not be there. My aunt could not be there, only my husband. And if my husband left the hospital, he could not come back in. Especially with this being my second child, it was just like, you're already in a pandemic. Now you can't have your support system physically be there. And so I had to learn to be flexible in that moment and to be okay with it. I think a lot of times we don't give ourselves permission or allow ourselves to be flexible because, we have in our mind what we want to do, how we want it to go, what we want it to look like. And the reality is, with this pandemic, nothing is certain, nothing is sure. And so we have to learn how to be flexible. But at the same time, you have to learn how to be true to yourself. Be transparent. Get a support system. Do not be scared to say, you know what, I can't do that today. I am not doing well. And being able to reach out to those persons whom you trust, whom you know are going to care for you during that time, who may not understand fully what you're going through, but can say, I'll be present for you. I'll be here for you. And it's those little things that they do that can be huge to the understanding of what it is that you're seeking to do. And what you're seeking to do is to birth a healthy, happy baby. At the end of the day, that's what we all desire, and that's what we all want. And then the final thing that I would say to moms to be, and those who may be going through this process, is that it is okay to be a little selfish. A lot of times we want to give so much of ourselves to our children. We put their needs first, but you have to also be functional in order to meet their needs. So when Gigi said she felt so liberated by just going to swim, that was Gigi saying, you know what? I need to do something for myself in order to continue to be present for my children. And I didn't see anything wrong with that. And I actually applaud her for that because I think that that's huge. She saw a need for her own self and she sought to meet her own need. I am grateful for my support system who support me in taking care of myself. So don't feel bad for being selfish. Don't feel bad for saying, I need time for me, because you're being honest with yourself and you're being true to yourself. And I think that's the most important thing. So those are the words that I would want to leave with moms to be. I want to say congratulations. Guess what? You are surviving the pandemic. It is possible. Gigi and I are both witnesses of it. So I'm just going to encourage you to just keep pressing, keep pressing, keep pressing, keep pressing. It will, just like Gigi was saying, and I keep referring back to Gigi because she gave so many nuggets and what she shared and what she essentially said, despite everything that she went through, things that she didn't even have control over, she was able to keep pressing. And that's what the thing that we have to remember, no matter how much life throws at us.
My closing thoughts really are turning back to Elisa and Gigi, because as healthcare providers and frontline workers, even scientists, we can talk about these emotions and we can talk about this anxiety, depression, and stress, and we can show numbers and all that. And we can tell you it's common, but when you hear it from moms and saying and talking about the experiences from first getting pregnant or it being their second or third child, and then talking about these experiences, it makes it that much more real and that much more relatable. And so I commend you both on just sharing your stories. And so understand if there's any take home, it's that you're not alone. We're here to help. There are many avenues of support out there. We just need to find the right person to connect us, and whether that is family, friends, or our trusted healthcare providers, there is hope and there's help. And again, once again, take home, I couldn't say it enough, is that you're not alone in what you're feeling and experiencing. And so with that, I turn it to my colleague, Catherine.
Thank you, KRISTINA. I too want to echo my thanks to Gigi and ALISHA for really sharing your stories. I'm truly honored to be here listening to you and your experience. I'm very grateful for this opportunity. I want to extend the invitation to our community members that are listening, to our partners in the community, to reach out to our team if you want to learn more about Project Rescue. We're here to answer any questions. And I also want to reiterate, we have resources available in Spanish. I want to extend an invitation in Spanish to our community members who may speak Spanish or who may work with women who are Spanish speaking only. Estamos aquí para responder a cualquier pregunta. Thank you so much for your time.
ALISHA, Gigi, Catherine, and KRISTINA. As I said from the very beginning, this was going to be an amazing panel, and you have all exceeded expectations. From the Developing Brain Institute, I really share my heartfelt gratitude. Thank you for sharing your experiences. Thank you for sharing your candor. Thank you for your passion. And Gigi and ALISHA, thank you for being the wonderful role models that you are for all moms. As a reminder, please be sure to visit dcmaternalhealth.com to register for this year's National Maternal and Infant Health Summit, which will be held on September 15th through 16th. And as Catherine mentioned, if you would like to learn more about Project Rescue, you'll see the website address and email at the bottom of the screen. You can also follow us on Twitter. See you at the summit.